Hello friends, today we are going to discuss about expressed emotion. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be defining expressed emotion, what are the different components of expressed emotion, how to do the assessment, what are the recent research, and also the management of expressed emotion. Let's define expressed emotion. Expressed emotion refers to the caregiver's attitude and emotions towards the persons with mental illness within the family. And it also have been defined as expressed emotion refers to the quality of the family environment reflected in the comments, attitudes, and communication style of a relative towards the persons with mental illness. In simple word, it is the quality of the environment where the persons with mental illness reside. Again, why it is so important to study about expressed emotion? Because in various studies it has been found the expressed emotion is a predictor for future relapse. And this has been found in various mental illness such as bipolar disorder, depression, schizophrenia, psychosis, OCD, and eating disorder. So, be very clear. Expressed emotion is a predictor of future relapse. Let's understand how this expressed emotion predicts relapse. The first and the foremost, the researchers have placed expressed emotion within the stress diathesis model. That means because if there is a family environment is not conducive, if the quality of the family environment is very low, if there is a family discord, marital discord, stigma of mental illness within the family, interpersonal problems, stopping medication because of various reasons can cause relapse, especially with psychotic disorder, bipolar disorder, depression. That means expressed emotion has a role to play. Further, there are two other important models have been proposed with regard to expressed emotion within the family context. The first one is deficit model, second one is interaction model. What is this deficit model? The deficit model suggests that there is inadequate knowledge of information about the mental illness. And because there is a deficit in the knowledge, the attitude, the perception, and the communication style of the caregiver towards the family member or with the person with mental illness is very poor. And this causes relapse. Hence, the deficit of knowledge, attitude, and also behavior towards a person with mental illness forms the deficit model. But however, there is another one important model, interaction model. This suggests that people, especially the family members, make their own explanation of illness and the information provided by the professionals, and they come up with their own hypothesis and also the model. That means these two important models indicates there is a need for psychoeducation, especially with mental illness, so that the expressed emotion can be decreased. Let's look into the history, how this expressed emotion originated. The first person to observe this expressed emotion was George Brown in 1956. He came across the family emotion playing a significant role in prediction of relapse when he was working in Medical Research Council Social Psychiatry Unit of London. In 1950 and 56 time, the chloropromazine was introduced. Hence, there was a large-scale deinstitutionalization was occurring. Many patients were discharged from the asylum to the community. But however, within a short period, he realized there are many patients were relapsing and they are coming back to the asylum. What was the reason? When he looked into these patients, he found that the patients staying with the family members, especially the siblings, with the spouse and parents, whenever there is a high criticality, over-involvement, and also hostility, there is relapse. Hence, he said, there are some family important variables which are predicting relapse. Hence, he gave these 5 important components. They are into 2, IEE components and low EE components. What is this IEE? Basically, negative expressed emotion, critical comments, hostility, and over-involvement. These are high emotional expressed emotion components. The positive one are also called as low EE expressed emotion components, warmth and positive regard. Let's look at each one of them. First one is critical comments. Here, it is the expressing adverse or disapproving comments or making judgment about a person with mental illness. If you look at the careful observation of direct communication among patients and the caregivers, which clearly indicates there are critical comments by the caregiver towards the behavior or the symptoms or the signs of mental illness towards the person with mental illness, this potentially can lead to violence, and hence the patient may stop the medication to hurt the family member. At the same time, these critical comments were seen more often when the patient had negative symptoms. That means he is unable to have activities of daily living, especially when he had apathy, amotivation, alogia, asocialization, is withdrawn. The family members used to shout at them. That means critical comments, especially with negative schizophrenia, played a role. Further, you can assess these critical comments by watching the patient's interaction with the family member. Not only that, you have to see what are the content of the communication and way it is expressed, like increased tone, tempo, volume, facial expression, body language, gesture, and also how the person asks for help or gives help, and also where it is communicated such comments, whether in the presence of others or comparing the persons with mental illness, maybe with his sibs or else with somebody else. These kinds of critical comments can harm the persons with mental illness. Let's move into the second one, hostility. Here, hostility means unfriendliness or opposition behavior or unmanageable anger or irritation followed by critical comments leads to the rejection of the patient. These unfriendliness or anger is manifested by the caregiver. It is rated as being absent or present during the interview. Further, caregiver states that patient is causing problem for them deliberately and wishing to be dead. Here the caregiver says, wish I was dead. And he may request, please give me mercy killing to myself or to the person with mental illness. Or else he may also say death wishes and also leave away the patient. Or he talks about abandoning the patient, shouting at the patient, easily getting angry and irritated towards the patient, and also at times physical violence or even the gesture can be seen. This hostility also plays a crucial role in relapse of persons with mental illness. The third one is over-involvement. Here, the caregivers blames themselves for having a person with mental illness. They feel they have contributed for their son or maybe the brother or sister having mental illness. They have a chronic guilt, so hence they start sacrificing things. They become overprotective towards the patient and sometimes excessively being concerned for the patient and neglecting personal need of the caregiver. That means they will stop going to work. They dedicate their life in taking care of persons with mental illness. In during this over involvement, this discourages the patient's skill and self-reliance. That means everything will be done by the caregiver. Hence, the patient may not learn new skills or he may not go outside at all. In the long run, this hampers the patient's recovery and rehabilitation. Further, this is most commonly seen in parents, especially in mothers, and occasionally seen by fathers and rarely either by the relatives or the sibs. Let's look into the warmth. This is the positive expressed emotion. Here, it is assessed based on kindness, concern, and empathy expressed by the caregivers while talking about the patient. It depends greatly on the vocal qualities, with smiling, being very compassionate and accommodative, and also empathetic towards the patient's behavior. And also, this warmth plays a significant role in expressed emotion, especially low expressed emotion. Positive regard. This comprises of statement that expresses appreciation, acceptance, support for the patient's behavior, verbal, non-verbal reinforcement by the caregiver towards the patient. Positive regard is unconditional acceptance. Here the family states that they feel very close to the patient, they appreciate the patient's little efforts or incision for day-to-day activities or functioning. They state that they can cope with the patient's illness and enjoy being with him or her. Let's look into the assessment of expressed emotion. How do we do that? There are two types of assessment. One is clinical assessment, another one is structured assessment. Clinical assessment is history taking, either in the OPD basis or inpatient basis. Further, taking the personal history of caregivers and how they are coping with the patient's illness. Family history, what is the family structure, who is providing the caregiving to the persons with mental illness, and also you have to do a family pedigree charting and see what is the communication, what is the style of functioning within the family. Further, you need to interview and observe the family members, how they react or how they communicate with the person with mental illness. Further, when you are observing the patient, you have to see how the family members react, how do they speak, what is the voice, how the tone, tempo, body language, facial expression that is conveyed through feelings towards the person with mental illness. These attitudes and behaviors are studied, observed, reflected in actual interaction within the family of mental illness. That means you can do a clinical assessment and you can see what are the critical comments, whether there was hostility, whether it was over involvement, or else it was a warmth, and also positive regard was seen. But however, you need to know about the structured assessment, especially when you are doing research or else measuring the expressed emotion within the family context. There are certain scales which I'm going to review here. But however, you need to go through the literature which is available with regard to expressed emotion assessment. There are many scales available. Few of them are available here. They are Camberwell Family Interview Scale, Family Emotional Involvement and Criticism Scale, Family Questionnaire Scale, Level of Expressed Emotion, the 5-minute speech sample scale, brief didactic scale of expressed emotion expanded. That means there are various scales available, but the gold standard being the Camberwell Family Interview Scale. If you want to go through these scales assessment, there is a wonderful review article written by Shetty in 2015 in the International Journal of Health Science and Research. This is available online. You can find this article, and you can go through how these various assessment instruments do on comparison. Let's look into the gold standard measurement, that is Camberwell Family Interview Scale. This is a semi-structured interview schedule. It is to assess the expressed emotion with regard to the family which is to be interviewed. The interview takes at least 3 to 4 hours, and you will consider a high EE family if there is 6 or more critical comments or exhibited any hostility during the interview, or else if you see 3 or more scores on over involvement. Here, the biggest criticism of this Camberwell Family Interview Scale is you need to have the assessor, maybe 1 or 2 people who will assess the patient. At the same time, a person who is going to observe and rate them. And of course, it requires the whole family, especially the caregiver, the person with mental illness. And also, the interviewer requires approximately 3 to 4 hours, and after 3 hours, you need to do the coding of the interview. Many a time, in some of the institution, they do video recording also after taking the patient and the family members' consent, so that independently they can code the interview. But how do we choose these instruments? There are various instruments, as I mentioned. Depending upon the purpose of assessment, why are you assessing? What is the goal of your study or research? What is the duration of administration? How much time you have to do the assessment? Whether it is a self-administered or you need to do an interview by an interviewer or assessor. Whether the training is required, how much training has to be done, what is the assessment of the person, what is the baseline education for this person who is going to interview, number of people required for the assessment. Is it one interviewer or else many is required? For whom the scale is administered? Is it to the person with mental illness or to the relatives, or it is combined? What is the illness category? Is it for schizophrenia? Is it for OCD? Is it for depression or bipolar disorder? What about the copyright and the cost of the instrument? Based upon all these variables, you need to choose the instrument. However, the Camberwell family is considered as the gold standard interview scale. Let's look into the various research on expressed emotion with regard to mental illness. The first and the foremost I would like to place on record is this. Budzal and Hole did a meta-analysis of 27 studies exploring the role of expressed emotion in the outcome of schizophrenia patient. The results were stunning. They clearly reported that expressed emotion played a significant and a robust predictor for relapse in schizophrenia. This was one of the landmark articles, if you ask me. Further, Another important review article was published in 2016 in Family Process. This was written by McFarlane. The title of the study was Family Intervention for Schizophrenia and Psychosis, a review. In this review article, the author clearly mentioned expressed emotion played a crucial role in prediction of relapse. Not only that, the author suggested that why not implement the family intervention for persons with high risk of developing psychosis. This opened floodgates. There was another important review article came in 2018 published in Psychiatry Research. The title of the study was Expressed Emotion in Families of Individual at Risk of Developing Psychosis, a systematic review. This systematic review included 15 studies which studied the high-risk population in developing psychosis. Again, this study clearly said that expressed emotion played a crucial role in relapse. Further, this article also mentioned criticism was associated with higher level of symptoms and poorer functioning. Another important meta-analysis came in 2021 in the journal Psychological Medicine. This was a meta-analysis aimed to explore the association of expressed emotion and relapse, specifically focusing on timing of relapse and expressed emotion domain. This meta-analysis included 31 prospective cohort studies comprising of 2,284 patients were included in the descriptive review and 30 studies were included in meta-analysis and meta-regression. The finding of the study was stunning. The finding revealed that high expressed emotion significantly predicted early relapse, that is, less than 12 months. But it did not predict with regard to late relapse, that is, more than 12 months. However, higher level of critical comments significantly predicted relapse, whereas higher level of warmth significantly protect the patient from relapses. One more important review article was published in Frontiers in Psychology in 2017. Do family intervention improve outcomes in early psychosis? A systematic review and a meta-analysis. Here, 14 studies met the inclusion criteria for the review and meta-analysis was conducted. In this study, the family intervention for psychosis was found to be effective intervention for early psychosis service user and for the relatives. Again, adding evidence towards the early intervention in high-risk population and also to intervene whenever there is a high expressed emotion. Another important study with regard to expressed emotion and eating disorder. This was published in 2018 and published by Rennie in Current Psychiatry Review. Here, a systematic review of 30 studies assessing expressed emotion in eating disorder was conducted. The results of the study was clearly indicating that emerging evidence suggests that even a low level of parental criticism may be associated with poor treatment outcome, perhaps especially with patients with anorexia nervosa. And another very important study which came into picture. This was parental expressed emotion and psychosocial problems in child and adolescent psychiatry. There was a review. This review was conducted and they found that adolescents with psychosocial problems tend to have a parents with high expressed emotion. That means if there is a high expressed emotion in parents, the children will have various psychosocial problems. And they found that criticism was the most influential aspect with regard to affecting psychosocial problems in adolescent. That means there is a need to do family intervention, especially in IEE parents. Let's look into the intervention in expressed emotion. First and the foremost, a practical tip is to reduce the contact period between the persons with mental illness and the caregiver in whom there is a high expressed emotion. The contact period should not be more than 35 hours per week. Then, how to manage this? The patient can be placed in a halfway home or a daycare center, occasional rehabilitation, engaging the patient in meaningful activities so that the contact between the person with mental illness and IEE expressed emotion caregiver should be reduced. This is the simplest and a practical way to reduce the expressed emotion. Further, psychoeducation. As I mentioned earlier, the family psychoeducation play a crucial role in relapse prevention. As I mentioned earlier, Waroclog and his colleagues suggested the deficit model and interactional model played a crucial role in developing IEE. That means high expressed emotion especially with the deficit model means the family members do not have any knowledge and poor attitude towards persons with mental illness. By doing psychoeducation, it can be corrected. But however, in interaction model, the person with mental illness and caregivers need to be psychoeducated not once, many times, so that they not only this interaction improves their expressed emotion and also improves the outcome. Further, there are many family focused family therapy can be done. But however, practicality need to be understood depending upon the available resources, depending upon the patient and the family members, how many caregivers, whether we can do family therapy is the big question. What are those components? Communication skill enhancement, especially with the patient and also the caregiver. Problem solving, decreasing the expectation of the caregiver so that the critical comments, hostility, and over involvement can be reduced. Management of negative symptoms, especially with social skills training, those can be done so that expressed emotion can be decreased. Further, strengthening the family support system. Invariably, the caregiver's burnout is very high. Hence, you need to strengthen the support system so that the care giving for the person with mental illness occurs smoothly. Self-help groups can be created so that this group can intervene in crisis management. Supervised medication by the family member and case management should be implemented at the earliest. These are the various expressed emotion intervention can be done. But however, there are criticism with regard to expressed emotion that needs to be understood. First one is, as a psychiatrist or a mental health professionals, we are unable to cure a person with mental illness. That means we are unable to cure him. Let's blame the family. Earlier, we used to blame the mother, telling that she is a refrigerator mother, cold mother, she has double blind communication, hence the child developed mental illness. Now we are blaming the whole family. Since you don't have medication, let's blame the family, telling that this is a high expressed emotion, family, hence there will be relapse. That is one. Second one is categorical in nature with regard to expressed emotion. 6 critical comments, hostility, or 3 over involvement situation. If you are able to see, you will be calling them as high expressed emotion and labeling the family with high expressed emotion and saying they have a poor prognosis. Is it right? Just the person has a 5 critical comment during your interview, that means they have a good outcome. This categorical approach is also being criticized. Further, neglecting the family resilience. Here again, in expressed emotion, if you look into the studies, they looked into the only those 3 negative expressed emotion, that is critical comment, over involvement, and also hostility. But however, the studies are very less looking into the warmth and positive regard. Hence, we need to see that can we increase the number of publication with regard to the positive, especially warmth and positive regard, those studies need to be done. Hence, we need to focus on how to improve the resilience of the family, even if there is a family member who has mental illness. Further, the expressed emotion is assessed with regard to caregivers. But however, this expressed emotion fails to take the context where the person with mental illness is staying. It does not take the expressed emotion of relatives, friends, especially from the social places where the person with mental illness is working. That means we are neglecting the society who may express their emotion with regard to a person with mental illness. Hence, there is high stigma and discrimination that may add to the burden and also stress, and there may be a relapse. Further, cultural aspects. If we know actually expressed emotion fails to take the cultural context into assessment. Families in developing countries, in developed countries, they are entirely different. Family in an Indian situation versus family in a US is entirely different. That means how the family structure, family communication, who is the head of the family, how the family stays, how they share their responsibility also play a crucial role. Especially in India, you can see there is extended family, joint family, nuclear family. How do they support each other versus family in US? This cultural context is completely neglected in expressed emotion. Hence, we need to study how this cultural context play a role in expressed emotion. If you see this from a perspective of a developed country, example, A US psychiatrist does the assessment, especially in India, and he sees the mother is giving care to a person with mental illness. The mother may devote her life, and he may call it as over involvement, and he may say there is a poor outcome in this family. Hence, the context where this assessment is done, the cultural, religious, and also the family dynamics need to be understood. There was a study done in Schizophrenia Research in 2019. This was a meta-analytical review with regard to caregiving processes and expressed emotion in psychosis. A cross-cultural study was done. A systematic review yielded 96 studies to be included in the narrative review and 34 were included in the meta-analysis. And the reports were stunning. They clearly said that cultural adjustment need to be understood and we need to take that into context before interpreting the expressed emotion. Hence, this study, especially this meta-analysis, said that the clinical practitioners to have an awareness of the different cultural norms in relation to the caregiving and care receiving behavior of a person with mental illness. Just because you are from a developed country and you see a family from a developing country that may be from India, Bangladesh, Sri Lanka, and you say, without knowing their family context or cultural context, you should not interpret the family further. If you look into the studies in India, there was a publication done in 2019 with regard to review of various studies. It reviewed 16 studies which were included and which consisted of 8 studies with regard to schizophrenia, 4 studies with regard to OCD, 2 studies with regard to epilepsy, and 1 each in schizophrenia and comparing with bipolar and ADS. And the researcher said that the Indian studies with regard to expressed emotions are very few. Author further suggested that to explore the role of expressed emotion in predicting relapse and illness severity in our Indian cultural context. We do not have such studies comparing Western culture and also Indian culture. That is very important at this point of time. What are the future's direction? First and the foremost, the studies in India are very less. Hence, the future research should be focused on establishing the various parameters for the best accuracy for measuring the emotional recognition by using digital technology. That means, since the mental health professionals are very less in India, can we leverage this digital technology to assess the facial expression, the facial gesture, body language, and also study the emotion? Can we use this digital technology to assess the family so that this emotion-based assessment system can be available at every district hospital, primary healthcare center, so that we can understand the family context and also the family dynamics that can be intervened at the earliest. Not only that, the system should be available to the psychiatrist for future research and implementation. We need to do RCT with regard to expressed emotion based on the assessment and intervention studies from prospective follow-up study. Whether the expressed emotion in India, how does it play a role? Whether the critical comments play a role? Of course, few studies have clearly indicated critical comments and hostility in India play a role in relapse. But however, with regard to over-involvement, if you look at from the Western perspective, yes, there is a severe over-involvement when a father and mother devote their life in providing care to a person with mental illness. Should we call it as over-involvement, or as it is a family context where the mother takes care of his son or a daughter who has mental illness? Hence, these over-involvement studies have been very, very difficult to interpret from the Indian perspective. To conclude, my dear friends, environment plays a crucial role in manifestation or expression of genes. What is the environment here? Especially with persons with mental illness, it is the family. That family environment plays a very crucial role, especially in prediction of relapse. With a person with mental illness who has vulnerable genetics for expression of phenotypes, that is, mental illness. No doubt, expressed emotion plays a crucial role in relapse prevention and also in the outcome. Now we need to move From the deficit model, that is, the patient and the family members do not know the knowledge, to the strength-based assessment, that is, whether the family has warmth, whether they have positive regards, whether the family has resilience. Can we assess this? Can we strengthen it so that we can prevent relapse? Thank you very much for giving your valuable time. Stay safe.